And there are some things in your book that help people think through. I think one of the things that I loved the most was the checklist that he had on how to evaluate whether to do another chemo. Can you talk about that a little bit?
So I wouldn't know the first thing about evaluating a chemo. And so I observed Bob do it repeatedly. Because I think by the time he died, I think he had basically chosen, without really openly choosing, not to take the fifth one. We had it in our possession. It was an oral, and he just never took it, and probably died about 3 or 4 months later. So there were several that kind of, gave us wonderful time together. But he would, I basically would watch his process and took it and translated it in, into language that you and I understand, about, like, first understanding what is the purpose of this treatment? Is it curative? Is it palliative? Is it life extending? That's really important from the start. And I think a lot of folks that don't have a medical connection don't always understand that. I think there can be some real ambiguity with, okay, so what is this going to accomplish? If it's going, if it does its job, are we looking at me feeling, me having less pain? Or are we looking at, me getting cured? Or are we looking at me possibly getting some more time? And then the other thing he always took into account, and this one honestly was probably more when he would work through this, help patients understand this process. And that was there a big event coming up, the birth of a grandbaby or a wedding or something, that the person really wanted to risk some rough side effects to try to be present for, if that was the case. And then just what are those side effects, and how do they, with just evaluating those, and then finally, I think I have on there disease fatigue, and I think that's really where Bob got by the end, is that there had been just a lot of complications and side effects that had offered a really rough time, and it was time, and there wasn't, there was, in the sense that he did stay alive. I'm coming up on the 4th anniversary of his death in January, and I remember very distinctly at this time of year, that year, thinking, oh my gosh, he's going to die on Christmas. He's going to ruin Christmas for me. And I probably felt that way for a couple of days, and then I realized, oh no, he's not. He's not going to do that to me, and he didn't. And I said, we're gonna get to mid-January, and sure enough, we did. So anyway, that's not what you asked about, but yes, that notion of, it is your decision. You don't just have to take the next chemotherapy. It is very much your decision.
And I'm reminded of the discussions that we were having with Dr. Medina, the palliative physician that was on with us the last time we were with you, Jen, and her just really talking about how doctors who prescribe curative treatments are not always comfortable with this idea that maybe it's time to stop.
Yeah.
And having those conversations with your doctors, but also knowing within yourself, this is my line. Again, figuring out that line ahead of time, figuring out, when is it going to be time to stop, is so important. And so, Valerie, I want to turn to you. When people come to you and they're within this, should I take this next chemo? Should I stop? Is it time for me to stop? How do you help facilitate that decision, or what do you help people think about in order to make that decision?
Interestingly, a lot of the times they already know what it is they do or don't want to do or pursue. And so it's almost more of giving them permission that it's, what are their reasons why, like you had mentioned earlier, there's a holiday or an event that they're trying to, be there for, or not wanting to die on a holiday or in the holiday season and hanging on. And I would say the vast majority of the time, anybody who is, struggling with those decisions, again, it's already made, but it's verbalizing that decision. And again, majority of the time it's for someone else, not for themselves. And it's getting the family also to understand, to take themselves out of the equation, for your loved one. And again, true love, are you wanting them to fight for you or for them? And, you're not the person on the outside that's going through the treatments and the side effects. And Abigail, you had shared with me in the past, that just the simple terminology that we use around cancer situations and any disease for that matter, giving up or losing a fight, or, succumbing to the battle and the cancer's winning. And just to hear your perspective on that, it's really not very sensitive, not sensitive terminology. You even, I think, went so far as to say the cancer murdered someone, which is probably a much more accurate statement if we're being real. That's not because they're giving up. It's because, the cancer is doing what it's going to do. And what do we want that path to look like? How do we, giving the choice and giving the ability to make the choice, what do you want? What is your goal? That's usually a very big question. Is it quality of life? Is it quantity of life? Is it, you may have extended time, but again, what is that going to look like realistically? And, I often have to be very brave and courageous and also very sensitive to where people are at. There are people that don't want reality. And then there's people that look you in the eye and say, just be honest with me. What do you see? And so, yeah, it's very, like I said earlier, humbling to be in a position to help someone make their life or death choices. And a lot of times it's just listening.